So we have started this question. I guess you cannot see the question on the screen. So I'm repeating the cold sterilization by all the methods except you can see the four options: plasma gas, gamma rays, UV rays, and autoclave. The correct answer I already told you here, the autoclave. It's a method of moist heat. You can see this is autoclave. It works on the principle of pressure cooker. The temperature I told you 121 degree, time for 15 minutes, and pressure is 15 pounds per inch square. So it's a method of moist heat. It's not cold sterilization. That's why, because they are asking, except the correct answer is D. Okay, so we have already done this question. The second question also I have discussed. So I'm showing you the image now. You can see the second question, inoculation loops are sterilized by which method? The four options are in front of you. Is it autoclave, microwave, passing over flame for 3 times, or heat till red hot? So students got confused between option C and D. Some students by confusion, they marked option C, but no, the correct answer here is D, very specific. So here heating till red hot. So here you can see the Bunsen flame. So what we are doing, we are heating the tip of the inoculation loop in the Bunsen flame till it becomes red hot visibly. Because we assume there is a principle that all metals, when they become red hot in heat, all the bacteria, virus, fungus, and parasite present on them, they get killed and it becomes sterilized. So here we are heating it. Okay, and you know it is a metal made up of platinum or nichrome. The inoculation loop is made up of metal. Okay, so this was the question. The third question is in front of you. You can see test for antibiotic sensitivity. The four options are Alex gel precipitation test, E-test. I guess option was E-test. You know the full form of E-test. E-test is epsilometer test. So it is the correct answer. Okay, one option is latex agglutination test and CAM test. So the correct answer is the E-test or epsilometer test. It is a test for antibiotic sensitivity test. Alex gel precipitation test is for testing the toxigenicity of diphtheria. So it's not the correct answer. Latex agglutination test, it's a method of antigen-antibody reaction. It's an agglutination. CAMP is done for GBS, for diagnosing of GBS. So of course, it is not the correct answer. The correct answer is E-test. Here we put a strip, you can see, which is dipped in the antibiotic in different concentration. There is a concentration gradient. So you can see from lower concentration, this is lower concentration, till higher concentration, there is a gradient and we are trying to grow the colonies. So you get a drop shape or elliptical shape. Zone of inhibition. So the minimum inhibitory concentration is where that drop, the tip of that ellipse is joining, intersecting with the strip. So here it's a quantitative method where we are not just testing that particular antibiotic is susceptible or resistant. We can test the minimum inhibitory concentration also. So it's a quantitative method. Okay. So the correct answer is E-test. Okay. The next question in front of you, very easy question. 20-year male pustule rapidly progressed to necrotizing fasciitis. So the first clue given to you is necrotizing fasciitis. The image was not given. Image I have put. Okay. On microscopy, there is a gram-positive cocci. Reading the word gram-positive cocci in chains. It is in chains. You can remove the option Staphylococcus because Staphylococcus is in clusters. Okay. In chains, of course, it should be Streptococcus, one of the Streptococcus. And necrotizing fasciitis is typically caused by one of the Streptococcus, that is Streptococcus pyogenes. So the correct answer here is Streptococcus pyogenes. I guess the questions were very easy from microbiology section, isn't it? The next question, of course, again, it's a spotter. It's a very easy question. Mycobacterium tuberculosis typically grow on which media? The image was not provided. I have put the image. So the four options, algae media, McConkey agar, SDA. The fourth option, I didn't got it. Can anyone help me in recalling the fourth option? This question will be complete then. Yes, of course, the correct answer is algae media. We know typically Mycobacterium tuberculosis require 8 to 12 weeks. I mean 2 to 3 months for the growth. So we don't wait for starting of the DOTS treatment based on this, but for confirmation, we put the culture. So the selective media is algae media. You can see the green color media. You can see the yellow color, typical cream color colonies on the green media. So this is algae media. Here, one more question come. Usually it is asked that ag we use in this media. Ag is a solidifying medium. It's a solid media which don't contain agar. It's also important question, not asked now, but I'm telling you. So the next question in front of you, you can see there is a Gardner. The D option was NNN media. Thank you so much for helping me in recall. Thank you so much. The next, the last option here was NNN. So NNN is Neil, Nicole media. It is for parasites. It is not coming here. Okay. SD is for fungus. McConkey is to differentiate lactose fermenter and non-fermenter. for Enterobacteriaceae classification. So of course, it is not the answer. The correct answer is LG media. It was a very easy question. The next question, many clues are given in the question. There is a gardener. The first clue itself is a gardener. Okay, from Himachal Pradesh. The second clue is Himachal Pradesh. There is some disease among the options which is endemic in Himachal Pradesh. So Himachal Pradesh was also a clue. Having multiple ulcerative and nodular lesions on the limbs, maybe on the upper limb or lower limb, it is given or not given, I'm not sure, but multiple ulcers were there. Multiple ulceronodular lesions were there. And axillary lymph nodes were also swelled. And this image was given. Students told me that this image was given. Is it? This image was given in your question paper. So this image typically showing the rosettes. You can see the conidias arranged in rosettes. So what is the correct answer? Of course, no confusion. The correct answer is sporotrichosis. We are talking about lymphocutaneous form of sporotrichosis. So it occurs typically in rose gardener. Although the rose is not mentioned, but gardener is there. And Himachal Pradesh, the disease is endemic. And we can see the rosettes also in the image. Is the image was there? Okay, so the correct answer here is sporotrichosis. The next question in front of you, there is a farmer. Again, the first clue is the farmer. Okay, walking barefoot. So barefoot, again, the second clue. And having some granular yellowish discharge from the sinuses on the foot. So on the foot, multiple sinuses were there from which yellowish granular discharge was there. So what else you want? What else you want? The image was not provided, but in the question, you are having all the clues. The farmer is there, walking barefoot is there, multiple sinuses is there. The sinuses are discharging, having grains in that. Okay, the grains were yellow color. Of course, the correct answer is Madhurella mycetomatous. Okay, so image here, the image was not given. In the last question, this image was given. Okay, so this question was, the other options were nocardia, aspergillus, histoplasma, but it's a typical question. All the clues are given to you, whatever required for diagnosis. The next question also, again, I will say it's very easy, which is waterborne hepatitis. Okay, hepatitis A, B, C, D. So I always teach in my lectures, there are 5 types of hepatitis A, B, C, D. Among them, A and E is waterborne. I mean, the route of transmission is fecal-oral. And the remaining 3, they are not shedded in feces. That's why the B, C, D are not transmitted by fecal-oral route. They are transmitted either by parenteral route, most commonly. Second is sexual. And third is vertical. Vertical is from mother to fetus via placenta, transplacental. So the fecal-oral route occurs in A and E. Option don't have hepatitis E. That's why we are going with hepatitis A. It is waterborne. Okay. Sinus discharge was not given. Kaushik. So sinus discharge was not given. So what else information you get in this question? Maybe the sinus discharge is not there in the question. Okay. So what else? You may have some other clue. Na? Farmer was there. Farmer was there or not there? Was there? Farmer barefoot walking was there or not there? And after that, they must give you some other clue also for the diagnosis. Okay. Sinus word was not given. Granules were given. Granular discharge. Granular discharge was there. The granular discharge word was there. If the granular word discharge was also, that's more than sufficient for the diagnosis. Okay, got it? Okay, so the next we have already covered. Okay, so coming on the next question is Ascaris lumbricoids not associated with, or maybe which of the following is false about Ascaris lumbricoids, whatever was the question. So they have given 4 choices. Among them, one of them is not true or false or not associated with Ascaris lumbricoids. We have to pick up that choice. So the first, I don't know the sequence of the options, but one of the option was rectal prolapse. So definitely that is the answer, because rectal prolapse, I typically say and teach in my lecture, it is typically caused by Trichuria trichuris. It is not associated with Ascaris lumbricoids. Ascaris lumbricoids causes the diseases of the lung, diseases of the intestine, but not rectal prolapse. It is typically caused by Trichuria trichuris. So this is the answer. It is not associated. It is not causing Trichuria trichuris. Here, most of the infections are asymptomatic. Yes, it is true. Fertilized unembryonated egg takes some time in the soil so that it get converted into embryonated egg. We know there are 2 types of eggs, fertilized and unfertilized here in Ascaris lumbricoids, and it spread to the lung and it causes asthma-like symptoms. Of course, this is also correct, but rectal prolapse, no, never, it don't cause. So correct answer here is rectal prolapse. The next question is in front of you. Again, there is a farmer. If there is any correction, please let me know. Okay, these all questions are based on the recall. Okay, so if there is any correction, kindly let me know in the question also, in the options also, wherever. Okay, so the next question, there is a farmer presented with chest pain after a blunt trauma. So the history of blunt trauma is given to you. Farmer, first clue is farmer. There is a history of blunt trauma, and after that the chest pain is there. We have taken the pus from the wound and We have cultured it. And this image is given to you. We have done the microscopy, I'm sorry, not culture, microscopy of the pus. And you can see the image. Now, in the image, it is not mentioned, but looking at the image, you can identify it's the image of acid fasting. Can you see it is an acid fasting? You can see the organism is red color. It is mildly acid fast, and it is branching. So is this image was given? First thing you tell me. Is it image was given or not given? Some students told me the image was given. It was having a branching appearance and mildly acid fast. So if the image is not given, these terms may be mentioned. Mild acid fast organism, mild, not complete. It is partial acid fast. And the second thing, the branching is there. The typical branching is there. Okay. So branching occur in Actinomycetes species, that is nocardia. Nocardia is coming in that. So of course, the correct answer is nocardia, whether the image is given or not given. If the image is not given, they may have mentioned the findings in the image in the text only, or maybe the image is given. In both the scenario, the answer is not going to change. It's nocardia. It's a typical question on nocardia. It's partial acid fast because the concentration of H2SO4 for decolorizing here, we use how much we use for nocardia? We use 0.5% here for H2SO4. Standard, we use 20%, but here we are using just 0.5% H2SO4 for decolorizing in acid fasting. That's why we call it mild acid fast or partial acid fast. It is easily decolorized. It don't require 20%, it requires 0.5%. Okay. Okay. Okay, so maybe the image was not given, but they may have mentioned it is weakly acid fast and there is a branching appearance. So the findings of the image are given in the text form. It's okay, but the correct answer here is nocardia. Okay, coming on the next question, all of the following causing urethritis in males except, they're asking except, which of the following is not causing urethritis here. So of course, the most common cause of urethritis in males is gonococcus. Of course, it causes. Trichomonas can also causes urethritis. Okay, Trichomonas vaginalis, it also causes urethritis. Chlamydia can also cause, but Gardnerella don't cause urethritis in males. So the correct answer here will be Gardnerella. Okay, yes. The next question, what is the drug of choice for fasciola hepatica? Now, many students have done a mistake here. It was a little bit tricky question, not much, but there was a little bit tricky question. Fasciola hepatica is one of the trematode. We all know it is one of the trematode. It is a tissue trematode. It is known as liver fluke. We all know that. So for all trematodes, the drug of choice is praziquantel, and praziquantel was one of the options. So I think many students may have marked praziquantel if they don't know the exception. But among the trematodes, only one exception is there, that is fasciola hepatica, where the drug of choice is not praziquantel. The drug of choice is traclabendazole. So the correct answer here is traclabendazole, according to me, if this was the question. If this was exact the question and the options were these. So among the options, if traclabendazole was there, the correct answer is traclabendazole, because it is an exception. For all trematodes, the drug of choice is praziquantel. If apart from fasciola hepatica, any other trematode is asked, like schistosomiasis, like other fasciola busci, or any other trematode is asked, the correct answer would be praziquantel. But here it is an exception. So the correct answer here is A, that is traclabendazole. Okay, got it? Okay. The next question, which of the following is not an example of passive immunity? Very easy question. Okay. The options were toxoid, antitoxin, IgA, antibody, and monoclonal antibodies. So if we are giving ready-made antibodies or ready-made antitoxin, these are passive immunity. But if we are giving toxoid, by the way, what is toxoid? Toxoid is inactive toxin. It is a toxin which is inactivated by formalin. Okay, so it is inactive toxin. So if we are injecting inactive toxin in a human being, the toxin will activate the immunity in that human being. It is inactive. It will not cause a disease. Toxoid is an active toxin. It will not cause it, but it will activate the immunity, the natural immunity in the human being. And so it's an example of active immunity. Toxoid is an example of active immunity. It is not passive. It's common sense, of course. But if we are giving ready-made antitoxin, if someone is injecting ready-made antitoxin, my immunity will not get activated. Ready-made antibodies, any antibodies, natural antibodies, IgA antibodies, or monoclonal antibodies. So if I get ready-made antibodies, my immunity will not get activated. But immunity will get activated if inactive toxin, that is toxoid, is injected. So toxoid is an example of active immunity. So correct answer here will be toxoid. Okay. Question was easy, I guess. Common sense. So most common cause of diarrhea in children. I guess the question was a little bit clinical. They have given the age of the child as 2-year child. 2-year child was having severe diarrhea and dehydration. This was the question, I guess. Okay, I don't know the exact wording, but the crux is that they are asking the most common cause of diarrhea in children. Okay, so of course the correct answer is rotavirus. We all know the most common cause diarrhea here will be Shigella will cause dysentery. It will not be the answer. Okay. So here it is causing severe dehydration in a child we are asking. So the correct answer will be rotavirus. The next question, if there is any correction, please kindly let me know. Please write down. I know I am fast, but here I am discussing just question and answer. You have to cover all 19 subjects. That's fine. Okay. A woman present with malodorous vaginal discharge. Okay. The cervix appeared normal on examination. Cervix is normal. Cervix is normal and VIF test is positive. Do you have this question in your exam? I mean, with the same findings I have written. So the malodorous discharge is there. Cervix is normal. It cannot be trichomoniasis. In trichomoniasis, there is angry looking vagina. We know. So here cervix and vagina are not normal. Okay. VIF test is positive. Of course, there is no other choice. The correct answer has to be bacterial vaginosis. The correct answer has to be bacterial vaginosis. VIF test is positive now. If VIF test is positive, definitely the answer is bacterial vaginosis. If VIF test finding is not given, is this finding given in the question or not? If it is not given, then the question can be tricky and we can rule out other option. But if VIF test is positive, definitely it's a one-liner question. The answer is bacterial vaginosis. Now, was this question there? VIF test positive was given. I guess you're talking about the same question. The next question, was this question there? The pus swab should be discarded in which dustbin, in which container? In which container? The pus swab, according to biomedical waste management, the latest guideline, 2016 onwards. The latest guidelines, the pus swab we will take in the soiled waste. What do you mean by soiled waste? Any waste which is contaminated with human fluid, any human body fluid, and the linen is contaminated in that. The cotton is contaminated in that. The clothes are, we will call it soil waste. And all the soil waste go for incineration in the yellow dustbin. So here the correct answer will be yellow dustbin. If this question was there, because some students told me this question was there. Yes, of course, the correct answer is yellow dustbin. Okay. The last question here, the match the column. I guess everyone may have done it correctly. Match the column was there. Can you match it? It was a very easy. So donovanosis is caused by what? So of course, the donovanosis is caused by Klebsiella granulomatis. Oroya fever is caused by Bartonella bacilliformis. Okay. Red bite fever is caused by Streptobacillus moniliformis. And Pinta is caused by Treponema caritium. I guess if you can match one or two of them, you can match all of them. So this is the correct match. I guess these were there in the option. Okay. Got it? Okay. I guess I tried to cover maximum question. The session was informative. Thank you so much. Best wishes for you. Okay. Best wishes for your result.